Welcome to Another Thing. I'm Larry Menti. To paraphrase Donald Trump, who knew health care was this difficult? Republicans on Capitol Hill are having a difficult time coming up with a palatable plan to replace the Affordable Care Act. The House has already passed one. The Senate says it may start over. So where does this all lead? We'll talk about that with our first guest in a moment, but we begin our coverage with Ellen Kolodziej. Ellen.
Thank you, Larry. President Trump repeatedly said on the campaign trail that one of his first moves in office would be to repeal and replace Obamacare. In his first 100 days, a bill went through Congress but failed. Now, this second go-around, the bill did pass the House, but it looks like it has a long way to go before it passes the Senate.
Obamacare is a complete and total disaster.
Time and time again, the president insisted he would get rid of the Affordable Care Act. But now that a bill to do just that has passed the House, many Americans are saying, hold on a minute.
Make America sick again? Is that what the Republicans want to do? I certainly hope not.
I could tell you 3 members of my family, including me, that would be dead, and homeless if it was not for ACA.
To put it quite frankly, the House-passed bill would be devastating for Philadelphia, devastating for Pennsylvania, and as I said, a major step backward in coverage.
Andrew Wigglesworth has worked in healthcare advocacy for decades. He admits Obamacare needs tweaking, but says the Republicans' American Health Care Act, or the AHCA, is not the answer.
This isn't to say that we don't need to focus on healthcare costs and affordability, but basically there's somewhat overblown and overheated rhetoric on both sides of this equation.
The latest Congressional Budget Office report says, as it stands right now, the AHCA would cut the federal deficit by $119 billion, but that close to 23 million Americans would lose their health coverage. But the issue is so complicated that nobody really knows what will be in that final Senate bill.
We can't stand idly by and say Obamacare is working and everything's fine. We're trying to fix it. We're trying to bring premiums down. The CBO score that we do have said premiums had come down 10%. And so I think we're on the right track here. Obviously, it's a work in progress, but I think we're making progress.
So clearly there's a lot of negotiating ahead, but the Senate Majority Leader thinks he can get this to a vote by July 4th. But Mitch McConnell also admits that he doesn't think he has the 50 votes right now. Reporting for Another Thing, I'm Ellen Kolodziej.
All right, Ellen, thank you. Let's talk more about health care and what we might expect. Linda Schwimmer is the CEO and president of the New Jersey Healthcare Quality Institute. Thank you so much for being here.
Thank you for having me.
I know it's difficult to talk about because healthcare right now is a moving target. We have no idea what's going to come out of Washington. We know it's in the Senate and it's being changed. But I have a few points that I want to get clarification on from you. Everybody seems to be happy with the fact that those with pre-existing conditions get covered. Everybody seems to be happy with the fact that people under 26 can stay on their parents' plan. Everybody seems happy with some of the expansion of Medicaid. And yet they're not happy with the rising cost of insurance, the rise in deductibles, the rise in premiums. Isn't all that connected?
It is, but as we know, it's complicated. So let me try to break it down into a couple different groups for you. So the Medicaid population, so that's people who make 138% or less of the federal poverty level, they typically don't pay anything for their health care coverage, and we significantly expanded the number of people covered under Medicaid. And you said everyone's happy. The people who are on Medicaid are generally very happy. When they're polled and asked if they're satisfied, they're very happy that they now have insurance. I wouldn't say that everybody agrees with that. It's a philosophical difference. There's a lot of people out there that think that the role of government in healthcare should actually be scaled back. But when you say scale back, it might sound good politically, but what that means in real life is more people will lose insurance.
What is the cost if, for instance, there's less money going into the Medicaid program with the bill that comes out of the Senate and eventually signed?
So really what they're talking about is with the Affordable Care Act, the federal government allowed states to expand their Medicaid programs. New Jersey was one of many states that did that. And because of that, we now have another 550,000 people insured here in New Jersey. If the federal government were to, and they pay for most of the cost of those people being insured. It was 100%, it's scaling down to 90%. If we were to lose that sort of federal support, that's over $1 billion just in that support, not counting some other issues that go into it. That's $1 billion right there to our state. We don't have that kind of extra money in our state budget, and I'm sure other states are in a similar situation. So what would we do? We'd have to figure out who could stay in, who would have to come off, or what services you would want to take away to kind of keep more people insured. But then you start asking questions that are really tough to ask and things you wouldn't want to have to ask for your family. Do we want to get rid of vision coverage or dental coverage or pregnancy coverage? I mean, or coverage for
And these are for
elderly.
people that could not afford that coverage on their own.
These are for very poor people who cannot afford this coverage on their own, right? So there's no magic bullet here. We're talking about taking away a lot of money that's going to states now to help people, to help the states cover more and more people. In our state, over 500,000 people.
Why are insurance companies pulling out of some states and some markets?
So insurance companies are typically not pulling out of Medicaid. They're pulling out of the individual market. And the reason why they're pulling out of that market is that's the riskiest market. That's the market for people who don't have coverage from their employer. So a lot of it is people who are self-insured, or people who are out of a job. And so this is a population that kind of, sometimes they're on Medicaid, sometimes they're covered by an insurer. They kind of float around, and which means that by definition, they're a riskier population because unless they really need insurance, sometimes they don't get insurance. So when they really need insurance, meaning that they're sick, that they're going to have an operation, that they know something that an insurer doesn't know, they hop in the market. And insurance is all about predicting risk. So that's a really bad risk. When someone's buying something because it's like, I know that my house is going to burn down, and so I buy insurance when I smell smoke. That's not the insurance business that you want to be in. New Jersey is a little bit different because we had what's called guarantee issue before. So we had a lot of the rules that the Affordable Care Act put in place. So we have a more predictable market, but a lot of the country, they really, the ACA was brand new for them in terms of how they priced this kind of risk, and it didn't go well.
Would you agree that it was a big problem, though, and something had to be done?
Yes. Overall, the cost of health care is out of control, and we need to do something about it. And it's the cost of health care and health care services that's driving the premiums.
And this gets back to the original question. But what's driving the premiums also is the fact that we're now covering people with pre-existing conditions, and some of the benefits of the Affordable Care Act that people like and don't want to get rid of, there's a cost for that.
Right. I mean, people want women to be able to have coverage for their pregnancies. Makes sense. I mean, why else do you need health care coverage, right? I mean, the main things are birth and death, right? People want people to be treated fairly. They don't want women to have to pay more for health insurance than men because gender is a pre-existing condition, right? I mean, all of these things seem fair, but then in a sort of a societal way. But then when they get their individual bill and they're struggling to figure out how to pay it, that's where that fairness and some of those issues kind of break down for them.
Speaking of fairness, let me lay a completely unfair question on you. What would you like to see happen if you could change healthcare? If you could write the bill, what would it do?
I think that the Medicaid expansion was a very good thing, and I don't want to see that rolled back. But I do think that there is a lot we could do with our Medicaid program to make it more efficient. As far as the rest of the market goes, the commercial market for individuals, we have a lot of markets. We've got a small group market, we have an individual market, we have business markets. A lot of those markets could be consolidated and have everybody in the same pool. We could look at a buy-in sort of scenario where people could buy into our state health benefit program or maybe buy into our Medicaid program. I think we need to start looking at larger pools. I don't think we're going to get to a single payer system, but we can get to some of the benefits of having one big pool by kind of tearing down a lot of these silos. And then what we really need to do is look at the cost of healthcare. We need to look at the cost of all of the different types of services. And we also need to look at focusing on investing on keeping people healthier. A lot of the service, diabetes is costing our economy billions of dollars, and just keeping people healthier, that's going to take a long time. But that would be a tremendous benefit from both a cost standpoint as well as just a wellness standpoint.
Yes, a societal standpoint.
Right,
Thank you very much.
right.
Amen to the last thing you said. By the way, you'll come back when we know more about what's coming out of Washington.
Thank you.
We'd love to talk to you then. Linda Schwimmer, who is the CEO and President of the New Jersey Healthcare Quality Institute. When we come back, there is a fear of traveling these days because of terrorist attacks. We'll find out if any of that is founded with our next guest when Another Thing continues.